Hey everybody, it's Fahim here and welcome to this video by Medlearn. In this video, we are going to be talking about how do you get a job in the UK if you're a pharmacist. So as always folks, subscribe, like and share, and let's get into the video. Right, pharmacy job in the UK. It's a good question and it's an important question because at the end of the day, we all need to make a living. But I want to say something to all the pharmacists that are out there today listening to the video or future pharmacists. Do not limit yourself to just pharmacy. Number one, do not limit yourself to just pharmacy. Because if you just have one income stream and something happens with that income stream where for some reason you're not able to do your job or that's the only source that you have, then you're stuck. So while you're watching this video, ask yourself, do I just want to be a pharmacist? Or do I want to develop my skills so I'm more employable or able to generate different income streams? That's my question to you while you're thinking about this video. Challenge yourself. Challenge your mindset, challenge what you're thinking, and then you'll be able to do more. But in terms of getting a job as a pharmacist, I think there's a couple of things to consider. Number one, you could work as a community pharmacist. And we'll talk about these in depth. Number two, what I enjoy is entrepreneurship. And running a pharmacy business. We'll talk about this. Number three, you could work in a hospital as a pharmacist. So you could be a hospital pharmacist. Number four, could be general practice. Number five, it could be as an academic pharmacist. And the list is endless. You could go work in, and I'm just about to say it, you can go work in industry. So you could be a pharmacist that works in industry. As you can see, my mind is playing up. You could work in industry. The list is endless. You could go work in marketing. You could go work in medicine information. The list goes on. But the common ones that you folks are going to be used to are community pharmacy, entrepreneurship, this baby right here. And then we've got these. Let's talk about first a community pharmacist. What do you need to do to get a job as a pharmacist or a community pharmacist? Number one, develop your skills. Make sure wherever you do your pre-registration, you have experience. And folks, experience doesn't mean just following a framework or getting signed up for your pre-reg exams or getting signed up for some competencies. Competencies are important. They're important because they tell us if we're good at something. But the problem with competencies is that they become very laborious and checklisty. Checklist. You know, for example, I could be a pharmacist. I don't know exactly how to measure blood pressure. That I know how to do. I follow checklists. I get signed off. But what about thinking on my feet? What about problem solving? What about challenging and being critical? When you look at something, you identify strengths, weaknesses, assumptions, bias. What about thinking, say, wait a second, let me hold back. Is this correct? So, as a community pharmacist, first of all, develop your skills. Think about AI. Think about your AI skills. Can I use AI? Because it's going to be coming. So to get a job as a pharmacist, community pharmacist, yes, it's not that difficult. Go to NHS Jobs. Go to Indeed. Approach local community pharmacists. LinkedIn, network. Great opportunity, LinkedIn, and you will get a job. In terms of salary wise, you're looking at about, these days, around 30 to 35 pound an hour is what you're looking at as a community pharmacist. So you're looking in the region upwards of 50,000, 45 to 50,000 pound upwards you're looking at. But remember, the higher you earn, the more you earn, you're going to have to think about the tax as well. So keep that in mind. So as a community pharmacist, one, develop your CV. Two, make sure you're competent in all areas. Can you do pharmacy first? Can you do NMSs? Can you diagnose and treat? Are you a prescriber? Because Even as a business owner, I'm looking for pharmacists who are competent. I'm looking for pharmacists who are confident. I'm looking for pharmacists who can do skills. So it's not going to be good enough that all I can do is check. That world is changing. A pharmaceutical technician can do checking now with the various courses, or they could go to the ACTs. And for those of you folks out there, pharmacy technician can't check, they can do an accredited dispensing checking course. So, that can happen. So it's not just about checking. It's about thinking out the box. Can I do my pharmacy first? Can I do my NMS? Can I do my flu vaccines? Can I do my COVID vaccines? Have I done all my relevant training? Am I ready for this? And you'll do well. And the more experience you have, the better. I've run a store that's done 10,000 items. I've run a store that's done 15,000 items. I've been actively involved in marketing, let's say, services. So it's going to be important to have that skill. Then we have this baby right here. Entrepreneurship, folks. This baby right here is so important. And if you're looking to become an entrepreneur, the most important thing I would say is you need to have broad shoulders. If you're going to do big things in life, then you've got to expect risk, and you have to expect to carry that. You've got to be mentally prepared. You can't be complaining. Okay? So if you're looking to set up a business, or you want to step out the box and step out your comfort zone, which I would recommend, then you have to have broad shoulders, folks. Things are not always going to go perfect. It's going to be like this. There's quite a lot more downs than there are ups. But that's the business for you. There's a lot more downs, but it's okay. So as an entrepreneur, number one, are you regularly learning and testing yourself? 2, are you surrounded by great people? And again, what does great mean? I don't have time to go into this because I'm assuming you know what great people is, and yours and my definition is the same. It might not be. But are you surrounded by people that motivate you, inspire you, and more knowledgeable? I would say if you're looking to set up your business, this is what you need. Number 1, I would say, have an accountant on board that you can trust. Number 2, have someone in law that you can trust. And number 3, agony aunt, someone that you can cry to and discuss with. So accountants, law, agony aunt are going to be your 3 best friends, and you yourself, you're going to be fine. And then we can think about setting up a business and running a pharmacy business. Then we have hospital pharmacy. Again, folks, some websites, NHS jobs is a good website to go to. You can go and check it Indeed. And be prepared to call. Be prepared to pick up the phone and have conversations. But these are some areas that you can do. Again, salary-wise, hospital pharmacists get paid less than a community pharmacist, and it works on bands. So that's important to have a look at the NHS banding. General practice pharmacists, again, very similar. But in general practice, you again need to have relevant skills. In a hospital pharmacy, they will make you undertake the diploma, a clinical diploma. And let me tell you something about a clinical diploma. Please make sure that you don't fall for the trap thinking a clinical diploma teaches you the clinical skills that you might think. It does teach you skills, but it might not be diagnosis, management of disease. Be careful. But in a GP practice, what do you have to do? Number 1, you need to be able to do structured medication reviews. Number 2, you might be required to do managing diagnosis of acute conditions. Number 3, you need to have the confidence and the capacity to use various IT systems. So there's quite a bit that needs to be done in general practice. It's a bit different to community pharmacy, but it's nothing impossible. It's fairly straightforward. There are various long-term conditions that you need to be able to tackle. Long-term conditions. So that's what's required. Again, look at Indeed, be active on LinkedIn, have a look at NHS jobs, and you're going to get, again, the salary, you're looking at, I would say, around 28,000 plus. 28,000 plus. These 2, we are going to leave for now. So in terms of how to get a job in the UK, there's a lot of options. It depends how proactive you are. It depends how much you're willing to push yourself. Otherwise, it's more than possible. Don't worry about the money. Focus on the knowledge. Thank you for watching. Hey everybody, it's Fahim here, and welcome to this video by MedLearn. In this video, we are going to be talking about how do you get a job in the UK if you're a pharmacist. So as always, folks, subscribe, like, and share, and let's get into this video.